Howdy, my name is Roger Worthington. I'm an attorney here in Los Angeles, and I've known Dr. Cameron since about 1995. And just real quickly, here's how I met him. Back in the day, in the 80s, the prevailing thought in the medical community was the only chance a mesothelioma patient had for survival was to have his lung ripped out, a procedure known as the extrapleural pneumonectomy, in which the surgeon basically amputates the lung. And I heard about Dr. Cameron about 1995 at UCLA as a doctor who had an interest in sparing the lung and just removing the tumor that surrounded the lung. And so I got to meet him, and we talked about the theory, and it was interesting because he was very passionate about what he did, and he kind of let me know that the difference between his procedure and the extrapleural pneumonectomy was simply time, attention, and passion for spending the time to remove the tumor. And so I had a theoretical understanding of what he was talking about. Back then, the pleurectomy decortication was considered palliative, which simply meant that it was something, a stopgap measure, no intent to cure. So most patients heard that word and said, I don't want to go there, I want to get a cure. So he said, well, look, you have an interest in this disease, you're an attorney, don't believe what I say, come watch me. So actually, I scrubbed in. I think I'm the first lawyer ever to scrub in during a procedure. In about 1998, at UCLA, I scrubbed in, had the gown on and the respirator and the hat, and I walked in there, and I was pretty fit and robust. I was an athlete, and I got to know the patient, and so I got there about 8 o'clock in the morning, and Dr. Cameron began the procedure at about 9. And again, I'm very fit, I'm very sturdy, I'm very eager to learn. I even had a camera in there, I was taking pictures, and it was just like, who is this guy? He's an attorney in the OR? Wait a minute, an attorney in the OR and you're a doctor? You must be very confident in your ability. And so I stood there for the first hour just very eager, learning everything. He's talking to me, talking to his resident. And then after the second or third hour, I started getting a little bit wobbly. And like, I got to go to the bathroom, I got to go eat, you know. And about the 5th hour, I'm sitting down, I'm kind of glazing over. By the 6th or 7th hour, I can't take it anymore. I have to leave to go get some food, come back. He's still there. Dr. Cameron is still standing over his patient. He hasn't had a bathroom break. He hasn't eaten a morsel. He hasn't had a sip of water. So his endurance was amazing, his durability. He refused to leave his patient's side. In fact, he had trained himself like a desert camel to live off very little water. I said, well, how do you go this amount of time without drinking water or going to the bathroom? He goes, I just practiced it. I trained my body to not need water or to relieve myself. So the guy's got amazing skills and control. That's number one. Well, that particular procedure was amazing. He pulled a 11-pound tumor out of this patient's chest, and at the 12th hour, I remember he sewed the patient up. So he had been standing over that patient for 12 hours. During that procedure, one of the local doctors came in. So, Dr. Cameron, I hear you're doing this big massive operation. This was about 1 o'clock. He goes, geez, how long is that going to take you? And Dr. Cameron said, as long as it takes. I don't look at a clock. I do my job. I meticulously remove tumor and spare the lung. However long it takes, that's how long it takes. The guy goes, it's 1 o'clock. I got to go play golf. I've already done 4 breast augmentations. So in terms of like a doctor, an OR as a profit center, Dr. Cameron was using that OR in the interest of that patient, doing a procedure that probably didn't award or reward UCLA all that much money. And that's when it struck me that Dr. Cameron has an amazing work ethic, a blue-collar work ethic. He will do the impossible, whereas most doctors want to get in and out, amputate the lung, be on the golf course by 1 o'clock, 2 o'clock. He'll spend 12 to 13 hours over his patient. And that's when I began to believe in Dr. Cameron and believe in his methods and believe in his science and believes in approach. So from that point on, I became one of his biggest supporters, and it's been my pleasure to help fund research that he's interested in through the Pacific Heart Lung Blood Institute, and earlier, before that, even the Punch Worthington Lab on behalf of my father. And so this is kind of a good day for us to actually a couple of years after we met, over a decade later, to see PMC flourish in its own laboratory space with an able staff. So future's bright. As long as Dr. Cameron is operating on a patient, the future is very bright. Thank you.